So a cataract is when the natural lens of the eye becomes cloudy over time. This usually happens when people get older, but it can also happen faster in specific situations, such as if someone's diabetic or if someone's had injection treatment or trauma. Sometimes the natural lens can then become harder more quickly. When should people look at having it removed? So this is a very individual question for people. Personally, I would say when it starts affecting your quality of life. So for example, if people are struggling, particularly with things like driving, then that's a really good time to seek advice. You don't really want to have a cataract operated on too soon, because I would say at that point in time, the risks would outweigh the benefits. But you also don't want to leave it too long, because the longer you leave a cataract, the harder it gets, and sometimes the risks of the surgery can go up slightly. So you kind of want to hit the sweet spot of getting it at the right time, but when the risks of the surgery are worth, although they're minimal, are worth taking. So cataract surgery is the removal of the natural lens from the eye when it becomes thick with cataract, and it's replaced with a plastic lens that we call an intra-ocular lens, so a lens that goes inside the eye. And there are some myths where people think that the eye is taken out. I can assure you that this doesn't happen. This surgery is done whilst lying flat on your back. Some people do struggle with this, especially some people that like to sleep with lots of pillows, but temporarily they will, maybe for 20 minutes, have to lie flat on their back. And then we use micro incisions. So we're talking incisions around 2.2 or 2.75 millimeters in size. And we use an ultrasound to break up the natural lens of the eye, and a kind of vacuum cleaner effect to remove it out of the eye. And then we replace it with the intraocular lens, which is really clever, and it comes out of the injector all folded up. We put it into the eye, and once it's inside the eye, it then opens out. The operation can be done under what we call local anaesthetic, so that is using just numbing drops to the eye only. There's another type of anaesthetic we can give in addition that goes around the eye. Some people can have that. But if you're really anxious, you don't really want to know what's going on, you can always opt to have sedation, which is where you also have numbing drops, but you will receive a little medication into the back of the hand, into a vein. It will just make you feel a bit woozy. Or of course, there's the option, as long as you're healthy enough, to be put to sleep, which is called a general anaesthetic. So the intraocular lens is a small plastic lens that's used to replace the natural lens that has been removed from the eye. It's a bit like a camera. You need a lens with a power in it in order to focus an image on the back of the eye or on the film of the camera. The lenses that can go in the eye have to be really carefully calculated in order to get that focus in the right spot. If you have a very big eye, so if you are short-sighted, you need to make sure that you have a lens that's got a certain power to hit the back of the eye where it needs to. And if you've got a very small eye, you'll need a different powered lens. So there's the power of the lens that needs to be taken into consideration. There's also something called a toric lens, which is where a lens could be powered to the point where it's slightly different in one direction to the other. And why would you want this to be done? Well, if the cornea has a lot of astigmatism, so if the cornea is not spherical, some people say more like a rugby ball than a football, then the light focusing on the back of the eye is not going to be the same in every single direction. So you would need, or can have, a lens called a toric lens that effectively helps with the astigmatism element, as well as the size of the eyeball element where it's going to hit the eye. On the NHS, depending on which trust you're at, there will be some trusts that will offer toric lenses, that won't offer toric lenses. And if they are offered, sometimes you have to have quite a significant amount of astigmatism before you're offered that lens. In the private sector, we're able to use a whole variety of lenses. Not only can we use special toric lenses, perhaps any time that there's astigmatism. So it doesn't necessarily have to be a huge amount of astigmatism. It could be just a moderate amount that we could correct. But also we have lenses that can help with multiple focus points. So for example, there are some lenses that will only give you the outcome of seeing well in the distance, and then you'd need to wear reading glasses to see anything up close. In the private sector, we have the luxury of lenses that can offer help with distance and intermediate vision. There are some that can also do reading vision, all in the same lens, and that can help with patients that are really keen to be independent of wearing glasses. And what I would say is that it's really important to speak to your cataract surgeon about what the right choice is for you, because there are some patients, especially in my area where I'm a retina specialist as well, so some people may have a lot going on at the back of the eye, and it may be that I don't think that they're a suitable candidate for these lenses because there can be some side effects that can happen, such as halo and glare. But it would be really on a case-by-case basis, as I said, speak to your cataract surgeon to see whether you'd be a good candidate to have these lenses. They're called premium lenses. So you can ask whether you're eligible for a premium lens, whether you're eligible for a toric lens, and you can have a toric premium lens as well. But yes, there are lots of different lenses out there and lots of companies as well. So cataract surgery, in terms of the way that it's carried out, is fairly standardized. But sometimes there are things that can make cataract surgery tricky for the surgeon, and I usually split those into two sections. There's factors for the patient generally, and then there's factors for the actual eye. So things to take into consideration generally would be whether the patient can lie flat. If the patient really can't lie flat, they may want to consider having a general anaesthetic. Things like diabetes. If they've got lots of diabetic swelling at the back of the eye, sometimes I do a combination treatment of giving intravitreal injections either before the surgery or even on the same day as the surgery, and do a combination treatment. Sometimes people have other conditions that make them a tricky candidate to operate on. So it's really important that we know the whole history of the patient, all the medical history, all the medications that they're taking. Are they taking blood thinners that will make them slightly more at risk of bleeding? Are they taking prostate medication that can affect the iris? So all of this needs to be taken into consideration. And then you also have the eye itself. So is it a particularly long eye, which would put the patient at slightly higher risk of retinal detachment? Have they got a very small pupil? Do they need extra help during the surgery to help that pupil get bigger? Have they had a history of uveitis and inflammation? Do they need some scar tissue removed at the same time as their surgery? So there's so much to consider, and it's really important when you see your cataract surgeon to make sure that before you go into surgery, that they understand exactly who you are and everything about you medically, everything about your eye, and then put that all together to give you the best outcome. So at present, I am working at Spire Bushy Hospital and St John and St Elizabeth's Hospital. I have a wonderful secretarial team that can be reached on 0203 642 3514 or email stacey.strong@virtualmedsecdirect.co.uk. And I have availability in clinics running throughout the week and ad hoc sessions for injections, fixed cataract sessions, as well as ad hoc, and anything else that you wish to discuss with me. Please book in.